Michael Barnes, your board certified psychiatrist. Welcome to the medical students and all the enthusiasts alike. Today we're going to go over the use of urinalysis in psychiatry, and particularly as it relates to diagnosing urinary tract infections. So let's jump right in, let's go. So the components of urinalysis are vast. I'm only choosing a few of them that are relevant to urinary tract infections: bacteria, white blood cells, I'm going to write here LE, leukocyte esterase, and nitrites, and obviously symptoms we'll talk about. What's interesting to me is that the medical community and psychiatry can often disagree on what's considered a UTI. On the strictest sense, you got to get what's called a culture and sensitivity. Let's just write that over here somewhere. Culture and sensitivity, where in most hospitals that will reflex, meaning it will automatically go to that if certain thresholds are met. Oftentimes, let's jump right into it, white blood cells. So many hospitals, the white blood cells have to be greater than 5 or even greater than 10 in order for the hospital to then culture the urine. So if it's 5 or less than 5, you can have symptoms and the urine won't get cultured, and it may be considered what I'm gonna write it over here, subclinical. Okay, I'm gonna call it subclinical UTIs, meaning they don't fit the exact criteria of what the medical community would consider a UTI, but in psychiatry, counting in mental health symptoms as classic symptoms as opposed to just urinary, and taking into account the whole picture, we may call something a UTI that the medical community doesn't. And to me, that's kind of fascinating. I want to highlight that here today. Moving on, obviously bacteria, right? I mean, urine should have no bacteria, and some place, you can look at it as few. Some urinalysis will write few or many. Okay, so few can often be looked at as normal, where we may not think of it as normal. White blood cells, we talked about that and how it reflexes to culture and sensitivity depending on the threshold. Leukocyte esterase is an enzyme that is found in white blood cells, often in response to one is fighting a bacteria. So you should not have leukocyte esterase, but oftentimes, if you have none of the other factors and just leukocyte esterase, the medical community may say, if you don't have urinary symptoms, you don't treat that. But if you have just leukocyte esterase and everything else is normal, but you also have some mental health symptoms that can't be explained, we will often reverse engineer and connect the dots. Interestingly. Nitrites. Nitrites are basically when bacteria enter certain environments, they'll convert nitrates to nitrites. So you should not have nitrites in the urine. And if you do, then that should be a suspicion that there could be, again, what I'm calling a subclinical UTI. And that relates to these symptoms. What do you consider symptoms? So obviously, if there's urinary frequency or any urinary symptom, it makes it obvious. But what if there's unexplained confusion, sudden onset psychosis, depression, anxiety, worsening of a mental health that can't be explained? Then you got to kind of go here, and we'll oftentimes treat it.